The purpose of this lecture is to illustrate the arteries that supply the upper limb, the neck, and the head, and we'll have a separate video lecture that details the blood supply to the cerebrovascular circle or circle of Willis, which is important in supplying blood to the brain. The illustration that you see here shows the arteries that come off of the aortic arch and supply the upper limb and the neck and head. And in the illustration we have the left ventricle of the heart, and coming off the left ventricle is the aorta. And so number 1 in the image here is illustrating the ascending aorta, 2 is the arch, and 3 is the descending aorta. The descending aorta is going to continue down the thoracic cavity. It's going to go through the diaphragm and then into the abdominal cavity, and then branch in the abdominal cavity to supply organs, and then eventually branch off into the lower limbs, and we'll look at those arteries next week in lab. And one of the things that can help learn the branches of arteries that come off the aortic arch is to learn your ABCs. A is for arch, or aorta, the aortic arch. And the first branch that comes off the aortic arch, which is number 4, is the brachiocephalic artery. And the brachiocephalic artery, as the name suggests, is going to supply the upper limb, the brachium, and the head, which is cephalic. The second branch off the arch is number 5, which is the left common carotid artery. And then the third branch off of the aortic arch is the subclavian artery. So you have your aortic arch, A, brachiocephalic artery, number 4, B, left common carotid artery, which is your C, and subclavian artery, S. So ABCs. Now this illustrates the typical anatomy, but there is atypical anatomy. In fact, the cadaver that we have has an atypical branching off the aortic arch, which you'll get to see. So the 3 main branches: brachiocephalic artery, left common carotid artery, left subclavian artery. So left subclavian artery continues as number 15, and then as it passes through the axilla, the armpit, becomes the axillary artery, and then as it passes into the arm, becomes the brachial artery. And this is also illustrated on the other side. Coming off of the brachiocephalic artery, number 4, is the right subclavian artery, number 12. Passing under the clavicle, as that artery continues in the axilla or armpit, it becomes the axillary artery, number 13. And then number 14 would be the brachial artery on the right. And then finally, the branch here, the left common carotid artery, number 5, is it has a right counterpart, number 7, the right common carotid artery. So notice that the right common carotid artery branches off the brachiocephalic artery, number 4. So you have left common carotid artery, right common carotid artery. And then the common carotid arteries, left and right, split or bifurcate into internal and external carotid arteries. So the internal carotid artery, number 11 on the left, and number 8 on the right. So the left internal carotid artery, number 11, right internal carotid artery, number 8, and then 9 and 10 are the external carotid arteries on the right and left. So 9 would be the right external carotid artery, 10 would be the left external carotid artery.